Hello, I'm Harvey Godwin Jr., Chairman of the Lumbee Tribe, and we are in a continuation of our efforts to encourage our people to vaccinate. Today we had the pleasure to be at the office of Dr. Martin Brooks. Of course, he's passed away for a couple of years now, but we want to thank his widow, Miss Pamela Lowry Brooks, for allowing us to use his office today. She was a schoolmate of mine in high school, and I was just happy to be able to do this. This office is very important to me because growing up, Dr. Brooks was my doctor, my family's doctor, my mom. She brought us here when we were kids. He was my mother's doctor up in age. And if you remember one thing about Dr. Brooks when you went into his office, you saw all these medical records. Dr. Brooks was not just our medical doctor, our first Lumbee doctor to come back here to us in Pembroke, but he was also our insurance provider. Many families didn't have insurance, so all those records you will see were where he charged his services and you paid him back in payments. That's just astounding that this man had the vision to be able to do that for his people. And I want to thank him today for everything he did for my family and all the Lumbee families during the course of his fine career. Today we have all the people you see behind me and beside me are Lumbee medical doctors. It's just some of them who are willing to step out today and encourage you to vaccinate. God bless you, and I hope you pay heed to every word that they have to say. Thanks.
My name is Joseph Roberts. I'm the CMO at UNC Health Southeastern. I'd like to, first of all, thank the tribe for getting this group of physicians together. It's a large group of Lumbee physicians that we've never had a group like this before. I just want to say that vaccines are working. It's a testament if you hear from all of these individuals that will tell you the same thing. At Southeastern, we're struggling. We really need the public to get vaccinated and really move the needle in Robeson County. Thank you.
Hi, my name is Dr. Elise Hunt. I'm one of the pediatricians at Lumberton Children's Clinic. One of the joys of my life has been able to move home and take care of babies from newborns on up to adolescents here in the Lumberton community. One of the most important roles a pediatrician has is preventative medicine. This COVID-19 vaccination is really important to continue that. The Academy of Pediatrics recommends COVID vaccinations for all children over 12 years of age. It has been proven to be both safe and effective. Please make a good decision for the family, for your child's health, and for our community's health. Thanks so much.
My name is Adrian Deese. I'm a pediatrician at Lumberton Children's Clinic here in Lumberton, North Carolina. Lots of families ask questions every day about the COVID-19 vaccine. Some common questions that they have are, is it safe? It has been proven to be safe in studies. Lots of parents want to know about side effects. If someone is going to have a side effect of the vaccine, it's going to be within the first 6 to 8 weeks after getting that vaccine. Lots of parents have concerns about, is my child going to be okay long term? Are there going to be things that happen in years to come? And that's something that only studies are going to be able to show. But we know that over the past year that these vaccines have been in studies at 6 to 8 weeks, common side effects being common, things are safe. There's not any long-term danger that's been shown. As of July of this year, 2021, over 8 million pediatric patients have received at least one dose of the COVID-19 vaccine, and many more hopefully will come to follow. So we're here today just to encourage you that this vaccine is safe, that this vaccine is helping to save lives, and that we encourage you to not be fearful about side effects for your kids, and we encourage all kids 12 and up to be able to get the vaccine. Thank you.
My name is Dr. Kenneth D Locklear. My office is in Red Springs at Robeson Pediatrics Associates. I've been practicing medicine a very long time, and I've never seen anything like this pandemic and stuff that we have now. It's very important stuff that you listen to the health professionals, listen to your physician who's giving you expert advice about what to do about this situation. It is imperative that you get the vaccine to protect yourself against the COVID-19, the Delta variant that we have in our county right now. It's devastating the people of Robeson County. and we had the lowest vaccination rate because of that. The other thing I want you to listen to is I want you to think of we physicians who are taking care of these patients that we've taken care of for years, and we're watching them die because they won't take the COVID vaccine or they're scared. We also think of the physicians who works in the ICU, who has a patient die from COVID, take them to the morgue, come back up, and assume the care of another patient who has COVID-19. This takes a toll on physicians and healthcare workers who see this every day. We're not used to this type of death from patients that we take care of every day. So think of us when you think of getting the COVID-19. Think of yourself, your parents, your children, and your loved ones, because those are the ones that you're protected when you take the COVID vaccine. I took mine as soon as it was available, and I am still here and working to take care of Robeson County. Thank you very much.
My name is Ginger Locklear. I'm one of the pediatricians at Children's Health Pembroke. As most of you know, I grew up here in Robeson County, went away to school and came back to serve my community. COVID has changed our lives. Fundamentally, our children can't go to school. We can't go to church. We can't function as a people like we used to. So I'm here to encourage you. Please, if you have questions, come ask about COVID vaccination. If you're on the fence and you have questions, I believe it's safe. And fundamentally, if you want to do something for your community, think about something that allows you to protect each and every one of us every day. I love my people. I don't want to see them hurting. And I encourage you to take COVID vaccination seriously. If for some reason you decide against COVID vaccination, I'll ask you to please continue social distancing, wash your hands. If you're sick, stay at home and seek care. But please consider it.
Hi, I'm Dr. Shelly Lowery, a family physician and Chief Medical Officer for Scotland Physicians Network. Why take this vaccine? After 18 months into this pandemic, we've lost a lot of people, friends, family, patients. And what I would say is 3.5 billion people in the world have received this vaccine. Over 300 million Americans have received this vaccine. At this point, the risk of COVID and the side effects and severe complications greatly outweigh the risks of this vaccine. Please protect yourself, please protect your family, be considerate of others, and take the vaccine. Please prayerfully consider the shot. Thank you.
Hey guys, I'm Ashleigh Freeman, family medicine physician at Maxton Family Practice, affiliated with Scotland Physicians Network. Interestingly today, my daughter asked me as a doctor, "Mom, what do you exactly do?" I thought it was appropriate since I had this interview today. Ultimately, I told her, I educate, I counsel, I treat, and I prevent disease. At this time, we are suffering greatly from COVID-19. It is wreaking havoc on our community. I'm reaching out to you today to consider getting this vaccination to help protect yourself, to prevent possibly from getting COVID-19, but definitely preventing severity of the disease, hospitalization, and possibly death. If you would even consider this vaccine, please talk to your healthcare provider, your physician, your nurse practitioner, your PA, to find out if this vaccine is safe and beneficial for you. If they did not agree with what we have said here today, I advise you to please seek a second opinion. Be educated, be informed, be safe. Thank you guys.
I'm Dr. Joseph Bell, pediatrician at Children's Health Pembroke. I've been a pediatrician for over 30 years. Part of what we do as pediatricians, of course, is vaccinate. So we have lots of vaccines we give in the clinic, and this is no different. Matter of fact, this is probably as important as any vaccine we give. So I encourage you to get your vaccination. I have gotten mine, all my family's gotten their vaccine. Matter of fact, I've already signed up for my booster. Do it, if not for yourself, which I think is important, do it for your children who can't be vaccinated yet. Do it for your friends, do it for your community, and do it for your tribe. Thank you.
Hi guys, my name's Katie Lowry, pediatrician with Robeson Pediatrics. I'm going to just ditto what everyone said already, but the one message I wanted to give you guys and the one question I have from my patients is, Dr. Katie, why are you giving this vaccine? You don't even know what's in it. Well, yes, we do know what's in it. It's a safe vaccine, and we want your children over 12 to get this vaccine. The other question I have from my children is, how can I be safe? How can I help others? Well, you can wear your mask, and I tell my little ones 2 and over, we can choose whatever mask you want to wear. You can wear a surgical mask, or you can be a superhero and wear your superhero mask, right? We can protect each other. You're protecting yourself and you're protecting others. That's what Jesus would have us to do. He wants us to love God and love people. In our medical practice, we get asked a couple of different questions, and I kind of wanted to highlight those. I'm asked by my young mothers who are breastfeeding, is this vaccine safe in breastfeeding? And yes, it is. I'm also asked by my little patients, Dr. Katie, how can I protect myself? How can I protect my friends in school? And I tell them the same thing I'm telling you right now, to wear your mask, to wait 6 feet, and to wash your hands often. They need us to protect them, guys. They need us to protect our little ones. If you are over the age of 12, you can receive this vaccine. Thank you.
I'm Dr. Aaron Locklear. I work at Pembroke Family Practice, associate with Scotland Memorial Hospital, and I'm a family physician. One of the topics I wanted to talk about was the risk of side effects from the vaccine are extremely low and very rare. The chances of anything bad happening to you with the vaccine are very low, and compared to medications that we prescribe daily, such as antibiotics or narcotics, the chance of a bad side effect or outcome with those are much higher. And this should not hinder you from trying to get vaccinated. And if you have any more questions or issues about side effects, just talk to your doctor about it.
I'm Dr. Chamaine Brooks-Locklear, and I work at Pembroke Family Practice. I practice family medicine here in town for the past 10 years or so. For the past year and a half, I've been seeing COVID patients and lately been counseling on COVID vaccines on a daily basis. As a physician, it is very tiresome to do this on a daily basis, okay? I encounter so many myths and so much misinformation about the vaccine. And my job is to make sure patients are very aware of the facts and the science, that this vaccine is extremely safe and highly effective, especially at preventing an admission from COVID. Some of the common misconceptions I see are that people assume if they have a prior COVID infection, they cannot get sick again, but that is not true. People do get repeat infections. My last patient in August had a prior infection in May, 3 months prior. So with Delta variant, anything is possible. Repeat infections are very real, and usually people are sicker the second time around. So all the science and data does suggest that a prior infection should still get a COVID vaccine to have extra protection. Another common myth I hear is that if you've had a prior allergic reaction or serious adverse effect of a prior infection, you can't get the COVID shot, but that is not true. So even if for whatever reason you cannot get a flu shot, for instance, a pneumonia shot, for instance, those shots are completely different than the COVID vaccine. So those are not a contraindication. It is still considered safe to get your COVID shot. Please be sure you speak to a knowledgeable physician when you're getting your medical advice. We are here today to encourage our community to please vaccinate to protect one another. Thank you.
Hi, my name is Tala Smith-Lowry. I'm a hospitalist physician at Scotland Memorial Hospital. My staff and I have been helping take care of patients infected with COVID-19 since this pandemic began. And right now our hospital is completely overwhelmed. Just to help put it in perspective, pre-pandemic our hospital was able to take care typically of about 7 to 8 ICU level patients. Just today alone, we had 17 ICU level patients, and 11 of those patients were critically ill with COVID-19. And unfortunately, none of those patients had previously been vaccinated. As a matter of fact, the majority of patients that we're meeting on a daily basis with COVID are unvaccinated. You know, this shot won't save every single person, but it certainly decreases your risk of getting severely ill and dying of COVID-19. It decreases that risk by about 90%. You know, this shot really is the best tool we have to keep you out of our hospital, out of our ICU, off of ventilators, and most importantly, alive and at home with your family. So if you've not yet been vaccinated, please consider it. It's safe. All the physicians you've heard speak here today have been vaccinated and fully endorse it, again, as the best way to keep you alive and at home. Thank you.
Hi, I'm Dr. Christina Hardin, and I'm a pediatrician at Children's Health-Raeford. I'm here today to encourage you to get your COVID vaccine. I have received my vaccine. My husband has received his vaccine. Our children, unfortunately, are too young at this time for their vaccination, but as soon as it is available, they will receive their vaccine. I just encourage you today. There's been too much death, too much loss to this COVID, and I call it a beast because that's what it is. We never know what it's going to do, what kind of variant's going to appear. Our only protection is this vaccine. Unfortunately, I have lost a close aunt to this virus. I've lost a cousin to this virus. So I urge you, please go get your vaccine. If you have questions, please speak with a reputable source. Speak with your family physician or speak with your pediatrician. Teachers, parents, please get your vaccine. Child care workers, please get your vaccine. We can protect our smaller children until it's time for them to get theirs. A lot of parents are concerned about the COVID vaccine and the risk of myocarditis. There is a small risk of myocarditis, which is an inflammation of the heart with the COVID vaccine, but the risk of getting myocarditis from COVID itself is much greater. So please do your part and get your COVID vaccine. Thank you.
Hi, my name is Dr. Charlene Locklear, and I'm a physician at TruCare Family Practice in Lumberton. I'm here to encourage you to get your COVID vaccination. Not only is the vaccine proven to be highly effective, it has also been proven to be safe. Most people do well with this vaccine. Common side effects after are fatigue, maybe pain at the injection site, low-grade fever, headaches, body aches. Usually these symptoms resolve within 24 to 48 hours, and they leave just as quick as they came. This virus is killing people on a daily basis, and those that do recover are still, 30% of those or more are still having chronic complications from their COVID infections. It is attacking people's hearts, it is attacking their kidneys, it is scarring their lungs. So even people that survive it are not well for months or years to come. So I am strongly encouraging to people to get this vaccine. If you choose not to, or you medically cannot get the vaccine, I am encouraging to double mask, social distance, and wash your hands. We can do this together. We need to do it together for ourselves and for our neighbors. Thank you.
My name is Sarah Locklear Brewington. I'm a pediatrician at Samuel's Pediatrics in Raeford. And I just want to say, as a mom and as a pediatrician, that I completely understand the fear that we all feel. We all have this sense of uncertainty about what is going to happen with COVID, with school, with our family's health, with our friends. And it's just something we constantly think about all day, every day. We have to plan, how do I keep myself safe? How do I keep my children safe and my family? And what we have is this miracle of a vaccine that truly is almost about the only way that we are going to get out of the situation that we're in. We are so blessed in our country to have access to something that is literally life-saving. There are people in the world who have nothing, no access to any kind of vaccine treatment. They are just out there without any kind of protection. So I just want to appeal to everyone who has parents and a spouse and your own children to protect yourself. Number one, it's okay to be selfish in this instance. If you get the vaccine to protect yourself, then you've done a very selfish thing and a selfless thing at the same time. You are protecting everybody in your family, everybody you work with, everybody in the grocery store, people you don't even know, and it's the safe thing. I think it's the unknown is the scariest part, but we have so much information about how the vaccine was manufactured, how it was studied, the side effects, which are real, but the alternative is COVID, and you have no idea how you do with COVID. You could be asymptomatic, you can be very mildly ill, but you could very easily be hospitalized, be on oxygen, be on a ventilator, or die, and we have seen that over and over and over. And if you have not been personally affected by COVID, you are extremely fortunate, because all of us know somebody who has lost someone in their circle, in their family, their friend group, their church. So I just honestly beg everybody, please get the vaccine, because we really don't have any other options. And yes, eventually this will be over, but how many people do we want to lose to get to the end of it? And it's just unnecessary. It's completely preventable. I tell patients every day who are 12 years and older, the vaccine is safe. Do not believe what you see on TikTok. Do not believe what you see on Instagram. It's not true. What we do every day is we try to educate and we try to advocate, and we try to comfort and reassure parents and children that we are doing everything we can in our ability and our knowledge and our power to protect you, to keep you safe, to keep you thriving. All of us want our kids in school. The way that we do it is to get a vaccine. And even if you don't have a kid in school, even if your children are grown, if you get vaccinated, then the more people get vaccinated, if you get vaccinated, your family, then you can tell them, oh look, I did okay. And that's one of the most powerful things, is you see your family or your friend get a vaccine and they're fine, then people are more likely to trust you because they know you and they know you care about them personally. So I just, all of us here today, we love our community, we love our family, our patients, and we just want to have the best outcomes for all of us. Thank you.
Hi everyone, I'm Hannah Warx, the Duke breast surgeon serving the community at Scotland Memorial Hospital and UNC Southeastern. I'd like to encourage everybody to reconsider vaccination at this point. We're getting to the point in the community where we're going to have to stop all cases that are considered elective or require inpatient admission. For this, that means that my patients, the breast patients specifically, will not be able to have their cancer operations, and all of their other life-saving measures that are procedural will be delayed. Imagine if that's your mother, your grandmother, your sister, your friend. In reality, it will be very soon. So I think this is the time that we band together and we stop thinking about what's right for ourselves and think about what's right for our community. I was vaccinated back in January when it was immediately available to me, and I was very early in my pregnancy at that time. It is safe for pregnant women. It is safe for breastfeeding women. It's been approved for children over the age of 12. At this point, it's time to have a conversation with your healthcare professional and determine whether it's the right thing to do for you and for our community at large. Thank you.
Good morning. My name is Sam Cummings. I'm an OBGYN physician. My office is in Pembroke, North Carolina, and I also live in Pembroke. These are trying times because of the COVID epidemic. There are very few of us that hasn't been impacted in some way, either by family members, loved ones, acquaintances, or even patients that have contracted this terrible disease. How it affects people varies, but there's been a lot of misinformation in terms of the vaccine, especially with pregnant ladies. There is no pregnant woman that intentionally wants to harm her baby, and that's the main concern that pregnant ladies have, is that this vaccine will harm my baby. What we know is that it will not harm the baby It will not give you COVID, and it does not cause infertility. What it does do is, if you are pregnant and you receive the vaccine, when the baby's born, it is also protected against COVID. It doesn't have that if you aren't vaccinated. Also, if you are vaccinated and you should get COVID, which would be a rarity, the chances of you being admitted to the hospital is very low. The chances of you having to be placed on a ventilator is even lower, and death is rarity. That is not so with unvaccinated pregnant women. Unvaccinated pregnant women have a much more difficult time than women that are not pregnant. So because of this, we are asking all of our pregnant women to please be vaccinated. Not only does it benefit you, but it also benefits your unborn child, and later they will have that protection from the vaccine. Thank you very much, and thank you for allowing this time.
As the Lumbee Tribal Chairman, I want to thank Dr. Chamaine Brooks-Locklear for helping organize this event today for this free medical consultation from our Lumbee medical doctors related in different fields. Thank them so much, and they are helping make our communities healthier and safer by what they've done today. God bless you all, and please consider being vaccinated. Thank you.
This shot is your shield.